Welcome back, everybody. Taking a break from cooking to talk about hip replacement surgery. Dr. Dr. Flannery is here from OSMS, and he brought along one of his patients, Carol Orweg. Good morning, guys. Thanks for being here.
Good morning. Thanks for having us.
You bet. So first of all, doctor, let's talk about a hip replacement surgery. It's come a long way, and let's talk about some of the candidates for hip replacement.
Yeah, so I think hip replacement, you decide to proceed with it when your arthritis is bad enough that it's really affecting your quality of life, despite trying all the conservative measures of weight loss, modifying your activity, exercise and medications, and really kind of becomes a point where you just have a frustration level, more bad days than good, can't do the things that you'd like to be able to do, and really once examined in the clinic, we decide, yeah, hip replacement would be the next step.
So Carol, let's talk a little bit about you and your story. How did you, know that this was a must for you?
I started to have hip pain when I hopped off my horse in, it was June of 2016. And it hurt a little bit and it got my attention, and I thought, what's that? But it went away. Unfortunately, over the next several months, every time I rode, I would have a little pain. By January of 2017, I would have difficulty walking after I rode. I could work a full day, I keep my horses at home, I could move hay, I could move feed, bedding, stalls, I could do all that stuff. When it came to riding, it was painful. By June, it was hard to mount, dismount, very difficult to maintain a long, relaxed leg, which is required in my sport. It just got harder and harder, and that's when I looked for orthopedic intervention.
Yeah, and so what brought you to doctor and made you go with him?
Well, I had done my research, and I knew that I needed a replacement by this point. I had seen an orthopedic surgeon who did some imaging and determined that that was the next step. He did not do the anterior method, and I really needed to get back to life. I had the surgery. I met Dr. Flannery, I had the surgery in early October. I was back to riding, back to work in 3 weeks, and then back to riding in 2 months.
That's amazing. You went home right away.
I went home, less than 24 hours.
And how are you feeling now?
I'm feeling great.
As you can see, she's smiling, she's happy, you're with your horses again, and life is good. So no regrets whatsoever.
No regrets whatsoever.
And it sounds like you really didn't have a choice, your quality of life. And
I could have given up horses.
Yeah.
I could have kept working and done other things in my spare time, but I just didn't want to do that. I'm not ready for that yet.
Right, so. No, or should you have to be? So doctor, obviously Carol was a really good candidate. How do you know, and for people who are at home who have been suffering with this pain, my dad also recently had hip surgery, how do you know who's a good candidate for this and this type of surgery?
Yeah, so most patients for me, the preferred approach is the anterior approach. In hip replacement, we talked about kind of when you know that you're ready for it. The approach, I think, can really be used in the primary, first hip replacement setting for almost all patients. There's select revision surgeries where I think using the other approaches, a posterior approach, gives you better exposure. And so in that setting, we would just make that decision, and at our group, we do all those approaches, so we have the option to just make the best recommendations for the patient given the problem.
You brought a model here.
So just wanted to show generally what the hip replacement looks like. So the femur side is hollow, so we actually are able to put the hip replacement stem down inside the bone, and so this fits securely down inside the femur bone, and we then put a ball on top of it, typically ceramic in patients that are more high demand, a little bit younger patient. We found that has the best wear characteristics long term. We also replaced the cup side as well, and so it's a metal shell that has a backing that allows for bone to grow on there. So within 6 weeks or so, you have good bone growth on there, and it makes it really nice and sturdy. And inside is a highly cross-linked polyethylene liner, basically a plastic that is the other side of the bearing surface, and has really good long-term wear characteristics. So once we've replaced both components, They fit together nicely and provide good range of motion and really gets rid of all the pain fibers that are at the end of the bone when you have arthritis. So we replace that surface and that gets rid of the pain.
That is really cool to see how you do that. Carol, thanks for sharing your story. Really appreciate it.
You're welcome. Thank
Helps
you.
to make, see how well you're doing, and maybe you're thinking about doing this. For people who want to find out more, what's the best way to get a hold of you guys, make an appointment, get a consultation?
OSMSGB.com is our website. We have Facebook page and blogs, and people kind of posting stories like Carol all the time. And you can certainly give our office a call and we can schedule an appointment.
All right. Thanks again, Doctor. Thanks, Carol. Appreciate it.
Thank you.
Coming up, back to the kitchen to make another delicious recipe. So don't go anywhere because we'll be right back.